Have you ever had that frustrating experience where you get like a sinus infection or a viral infection that lasts 4 to 6 weeks? But even worse, like your head is on fire, your headaches are just flared up, or maybe your migraines have tripled in frequency as well during this time, or maybe after? Well, I want to talk about what's going on within the body and the brain, and then how you can do some things to overcome this, to fix this in the moment so you don't have to suffer for weeks or months. Before we dive into that, just a quick introduction. I'm Dr. Kevin Wissman. I actually suffered with migraines for about 22 years and then also daily headaches for about the last 5 years. I've been in remission for over 4 years now. And I'm on a mission to educate everyone about what's really going on with their migraines and headaches to really understand the root cause of their symptoms so that they don't just have to manage their symptoms, but they can actually get to the root cause and start to prevent them. And so that they don't have to really be having these migraines or headaches run their life, but instead they can be in control. They can feel free and confident rather than fear or worry about the next migraine that's coming. But let's dive back in. So this topic stemmed from a client, Amy, who recently had a sinus infection and lots of sinus pressure on a lot of meds and steroids as well. And she was just really struggling with her headaches. She said in the past, typically they flare up, which great news. After working with us, her migraines, her headaches haven't flared up during her attack. I'll talk a bit about why that is for her and also talk about why when you're not doing the right work, they do flare up. But then she was running into a second issue where the headaches then started to flare up afterwards. And we'll break down really understanding, was this migraine or was this actually her brain and what we call neuroplastic headaches going on or being created because of this past experience with her. So we'll dive into that case a little bit more. Before we do, I just want to briefly explain like what is actually going on. Respiratory illness in our lungs, like the flu or just any type of bug that gets in our lungs that we're coughing a lot, or even gut infections. Right, there is more going on than just in that area. There is a flood of inflammation going on in the whole body, so we have something called pro-inflammatory cytokines that our immune system releases. The problem with those, even though that they are attacking the virus or the bacteria that's causing the problem with these cytokines is that they can cross into our blood-brain barrier, which means they can get to our central nervous system, our spinal cord, and our brain, where most of our headaches and our migraines come from, and obviously where most of our symptoms are at as well. And the thing is migraine is a neuroinflammatory condition, which means when inflammation is released into our body, our neuro or nervous system flares up and causes symptoms. And even worse, when our nervous system flares up, it then has this negative feedback cycle to cause more inflammation to be released. So just think about all of these illnesses causing inflammation. And the last thing our nervous system likes is inflammation because that causes our symptoms. So you can see this vicious cycle of this problem that's going on here. I like to think about the infection and the inflammation that comes from it almost as the match to a fuse. And then that fuse causes our brain to blow up and cause this migraine. And then things even worse happen where our brain becomes more sensitive to light, more sensitive to sound, more sensitive to stress and just everything that's going on during those times of year. Plus, you're trying to overcome an illness while continuing to live life, whether that's at work or taking care of your kids as well. And so now you should have a good, clear understanding of why your headaches or your migraines have flared up when a respiratory or really just any illness is going on in your body. And now I want to transition to talking a bit about what was going on for Amy and why her migraines, her headaches did not flare up when the illness was there and the inflammation was there. So first off, what she was doing with us is we were doing some nervous system regulation tools and techniques that have clear evidence that when our nervous system is in a regulated state, specifically some studies on the vagus nerve, things like autoimmune conditions can near go into remission. I always be careful with the word cured, but people are reporting no pain at all. And we see the same thing with migraines because when your nervous system's in a regulated state and it's stimulated, that is actually affecting our inflammation levels as well. And so there's plenty of studies to show that specific biomarkers in immune decrease as we are regulating our vagus nerve and our whole body's nervous system as well. We're not just targeting that one nerve, but that's where most of the research is at right now. And so when you think about it, our nervous system is this interconnected web throughout our whole body. It connects even to our spleen that runs our immune system and creates different autoimmune markers. And so if your nervous system is oversensitive or dysregulated, then of course your spleen is going to be as well, and your inflammation markers are going to be a little out of normal, which can then flare up other issues as well. And because Amy had been doing the work, her nervous system was in a good state. So her immune system was in a better state as well, which means she had less inflammation. She was still able to overcome the illness, but decreasing the inflammation levels in her body so that it didn't trigger a migraine or headaches for her. But then the big question for Amy was, well, why am I getting headaches now that I'm starting to feel better? And the biggest thing to understand is that she has developed something called neuroplastic headache on top of her migraines. Neuroplastic headache is essentially, it can present in many different ways. It can look and feel like a migraine, but what neuroplastic means is essentially your nervous system is moldable or adaptable, or it can learn things. And so because she's had migraines for so long, her brain has learned these symptoms and she started to create them as well. And to take that one step further, she mentioned to me on the call, in the past, when I get these infections, I tend to get headaches for weeks after the illness as well. And so that right there is a statement of a belief system that she's operating from, which means her brain and her nervous system's operating from that information as well. I like to think of our beliefs simply as like the coding in a computer or a software system. And then the symptoms we have is just simply the output that we see on a computer screen. And her coding says, well, because in the past, I got headaches that lasted for weeks after an illness, I'm going to continue to get them. And so even though her inflammation levels were lower, her nervous system was more regulated, she had these belief and this conditioned response or this learned behavior within her nervous system to cause these headaches. So she was recreating them. As soon as she learned and heard this from me, it was really interesting that her nervous system even just calmed down in the moment and she started to feel better immediately, which is pretty cool just to show what's possible. I think a lot of people, when they hear me say that, they might think that's crazy or not possible. But the best way I could explain it to you, I used to work in the emergency department during my training and fellowship, and people would come in after like a motor vehicle accident, and they might have had like broken a leg or an arm, but they were so focused on something else, whether it was like their kid in the car or a loved one in the car, they didn't feel any pain at all because their focus was changed to something else. Or if you want to think about changing like emotional states, not just pain states, we know our emotions are highly tracked or correlated with our pain states as well. If you think about a kid, maybe around Halloween, they go out trick-or-treating and then they've got their candy and they want to eat their candy at home that night. The parent says, okay, we can have one piece of candy, and the kid throws a temper tantrum. They start crying or screaming, getting really angry because they want to eat all their candy. But the parent knows that's not probably the best thing to give them a bunch of sugar right before bed. And so as soon as the parent gives in and says, okay, you can have 2 pieces or maybe 3 pieces of candy, what happens to the kid? Instantly, they calm down. They start smiling. Maybe they're laughing and they're very cheerful again, right? They, just like you, can change your emotional state in an instant. And you can also change your pain states in an instant if it is a neuroplastic pain or a conditioned response. Now, if you're in a migraine attack, then you've probably seen a past video where I was talking about and trying to determine the difference between migraine and the neuroplastic symptoms. It's really hard to shut off a migraine in an instant because you're in this neuroinflammatory or neurological storm, as I call it. But just know that a lot of our symptoms are actually neuroplastic and not likely to be migraine. And so you can shut down your symptoms in an instant, just like Amy did. An analogy I like to use is thinking about our brain is it's kind of like a smoke detector, right? And so the real infection basically is the fire that's causing the smoke. But then our brain is a smoke detector. And so it goes off at first, causing the symptoms, but then it gets stuck in this mode of being on or even causing false alarms. Or a lot of people like the analogy of like a guard dog that's become oversensitive. And even if it just hears the wind blowing, it's barking at nothing. There may be no one outside, not even a squirrel outside, but yet it continues to bark because it's stuck in this oversensitive mode. That is what a neuroplastic symptom is. It's just stuck on, even though the smoke is gone or there's no danger around. And so that is the neuroplastic part of it. It can get a little more complicated if you dive into it to understand that there is something called central sensitization that's going on as well. And that is when your nervous system becomes oversensitive to things like inflammation from an illness or to light, sounds, fragrances, stress, a lot of different things, poor sleep that can then lead to like brain fog and then the pain as well. But there's two things typically going on here. You've got this sensitive nervous system, but you've also got this learned response, or what we like to call neuroplasticity, where our brain learns this headache or migraine mode. So we need to calm down the nervous system, but also rewire it. Just like we did with Amy, we started to rewire this operating or belief system that after an illness, I don't get headaches anymore. And guess what happened for her? Things got better. So at this point, I want to move into a bit of like solution mode of talking about like what worked for Amy, what works for others, what might work for you as well. Briefly, I talked about the vagus nerve, and that's kind of like one of your most powerful nerves when it comes to calming down your headache or migraine symptoms. I like to think of it as like the brake pedal for inflammation specifically, not just for your symptoms, but for inflammation that then we know causes your symptoms. And so there's a lot of different things that you can look into, like resonant breathing or resonant breath work. Dr. Leo Lagos does a lot of this with heart rate variability and just finding like what your specific breathing rate is. Typically, the average adult, it's between 5.5 to 6 breaths per minute. That's a lot slower than what you're probably doing sitting watching this video. You might be holding your breath or having really shallow, rapid breathing. And so looking into something like resonant breathing can help as well. Just know that this work is a more proactive work. It does work somewhat reactively, but it's not the most potent thing. It does get to the root cause, but it takes time for it to fully kick in. So if you're just hearing this while you're sick, it's not going to be a magic fix and instantly fix it for you. It was for Amy because she had been doing this work in advance to prepare herself or to be proactive about it as well. There's another very common strategy that we have a lot of people use, and it's cold water exposure or cold immersion. And this essentially is what I like to call shocking the system or shocking your nervous system, but it triggers something called the mammalian dive reflex that puts our vagus nerve into an instantly activated, stimulated state, which is what we want in this state. And so it's been shown doing things like cold water immersion therapy or like a cold plunge to drop your inflammation levels and to also increase some levels that give you energy, like dopamine, norepinephrine, or adrenaline, for better terms that you might understand. All of these things giving you more energy while lowering your inflammation is going to make you feel better, but also calm down the nervous system in the moment and can calm down your symptoms too. And I get a lot of questions. I typically like maybe only 10% of the clients that I work with, I even recommend supplements or I recommend diets. It's a lot of effort and it's really shrinking your life, having to take more supplements and avoiding a lot of foods to get a little bit of benefit. I'm a big proponent of the Pareto principle or the 80-20 rule. Put in 20% of your efforts to get 80% of your results. And if you want to get that last 20% to optimize, you got to put in 80% more effort. So I like to focus on the things that move the needle the most, the 80% improvement with just 20% effort. And that's a lot of the nervous system regulation work. The diets and supplements, they're going to move the needle only about 20%, and your life gets smaller. You got to do a lot more work and spending a lot more money doing that too. But if you're interested, like this is the one time that I tend to recommend my clients, maybe when they have some hormone changes that their nervous system's not responding to, or in illnesses when inflammation's off the chart. And so the things that are most effective very quickly even faster than what I talked about earlier, like the vagus nerve stimulation and activation or the cold water immersion therapy, is anti-inflammatory protocol. If you look at the studies, you got to do something that's pretty aggressive. You want something that's very high in omega-3 fatty acids and then lower in omega-6s. So it's not just about getting a high dose of omega-3s, but you also want a good ratio. A lot of omega-3s, very little omega-6s as well. If you go and buy like a fish oil supplement from the grocery store or market or the pharmacy, if you get the generic product, there's a lot of research that's come out that actually those over-the-counter generic fish oils, they actually have a poor ratio and a lot of what's called saturated fats, which then causes more inflammation rather than less. That's a problem. And so you really want to have high quality supplements when it comes to high dose omegas. But that's something that like the studies, check with your doctor, of course, because there are side effects, some blood thinning effects as well from the omega-3s, but you're going to want high doses, something that's higher than what's on the nutrition or supplement label on the bottle that you get. I personally like liquid fish oil because it's easier to dose and it actually doesn't taste bad. You don't have to swallow a big capsule. They have done a really good job at giving really high quality, pure fish oil while keeping that fishy flavor away and no more fish burps. If you've ever tried that yourself and had that, get the good stuff and you pay for what you get ultimately. So getting that high quality omega-3 is going to be a good option for you. When you think about like neuroplasticity and stuck in that headache migraine mode, magnesium L-threonate is probably the best supplement around to reset your NMDA receptors within your brain. Those are kind of where some of your pain receptors are. But magnesium L-threonate is probably the best product because it's the only magnesium formulation that crosses the blood-brain barrier. Think back to what I was saying earlier in the video about cytokines. Most magnesium just sits in our body and our muscles, but magnesium L-threonate crosses into our central nervous system where our brain is at. And so it actually acts on the part that needs the magnesium most. And if you're thinking about other supplements specifically for anti-inflammatory protocols, turmeric and black pepper extract is probably the second best option other than high dose omega-3s for a fast acting anti-inflammatory result. And then ginger is a really good option in high doses. There was actually a study that compared 1,000 milligrams of ginger compared to triptans and found that they were exactly equivalent in effectiveness. And the ginger plays an extra benefit here with the inflammation going on with your illness as well. And so if I had to pick kind of labeling them in order or priority or effectiveness, high dose omega-3s always win out. And then going to curcumin and black pepper extract as your second option. Or, sorry, when I say curcumin, some people will call it turmeric. Curcumin is the active ingredient within turmeric. And then the third would be a ginger option as well. And if you feel like there's some neuroplasticity going on, magnesium as a supplement is great. But honestly, I very rarely recommend supplements because they're not going to rewire the nervous system the way that you're going to want. There are a lot better options that you don't have to take supplements. It's just about unlearning this headache migraine mode from your nervous system and then retraining it or rewiring it to work correctly. And so just to conclude everything that we talked about, understanding that migraine and typically headaches are a neuroinflammatory response, and these illnesses cause floods of inflammation, which is the last thing that a migraine brain or nervous system wants. But hopefully you have some hope now, understanding that there are some tools that you can reduce inflammation quickly, but also things you can do proactively in advance so that you can prevent these illnesses causing migraines in the future, because the viruses aren't going anywhere. They're going to be here. So it's important to keep doing this proactive work so that you're ready for them and you can move through that illness pretty quickly rather than destroying your life for 4 to 8 weeks. And also, I hope that if it really resonated that you feel stuck in that headache migraine mode, to understand why this is going on. Your brain is plastic or neuroplastic, and it learns this state, but anything that's learned can be unlearned. So you can unlearn this mode as well and get back to feeling better and getting out of this headache migraine mode. I've been there for 4 years, so I know that it works. I know that it sticks for you as well. If you found this video interesting or informational or educational at all, please hit the subscribe button below. I'm on a mission, right, to educate further and further everyone around the world with these conditions so that they don't have to keep suffering silently. And yeah, I lost a lot of years spending in dark rooms and just trying to push through at work, but then not being there for my family at home. So I'm really hoping the best for you. Please subscribe, like this video so that other people like you and me with these conditions can get out there, learn about it, and start fixing it to get their life back. And yeah, we'll see you on the next video. Take care.